If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, how should we control our diabetes? Answer by Jessica Spitty. Ketogenic diets are very effective at achieving two common aims of diabetes control: lowering blood glucose levels and reducing weight. A ketogenic diet is a very low-carb diet, considered to be when you eat a level of carbohydrate of around 30 grams of carbohydrates per day or below. The ketogenic diet was first developed by Dr. Russell Wilder at the Mayo Clinic to control epilepsy. It is still considered a very effective treatment for reducing seizures in patients who suffer the disorder. While it has been largely replaced by anticonvulsant drugs today, it is still used to treat patients with drug-resistant seizure disorders. According to the European Journal of Clinical Nutrition, there is strong medical evidence that the keto diet is also beneficial for weight loss, improving insulin resistance and blood glucose levels, and reduction of cardiovascular disease risk factors, including lowering blood pressure and improving cholesterol and triglyceride profiles. The ketogenic diet has the potential to decrease blood glucose levels. Managing carbohydrate intake is often recommended for people with type 2 diabetes because carbohydrates turn to sugar and, in large quantities, can cause blood sugar spikes. If you already have high blood glucose, then eating too many carbs can be dangerous. By switching the focus to fat, some people experience reduced blood sugar. Ketones are produced as part of weight loss. However, it's important for people with diabetes on insulin to note that ketones can be produced when the body has insufficient insulin. When the body has too little insulin, it means that cells of the body cannot take in enough sugar from the blood. To compensate for this, the body will start to break down fat to provide ketones. Note that it is important that you speak to your doctor if you are considering following the diet, as precautions may need to be taken before starting. Note: it is important that people with insulin resistance and diabetes to measure their blood glucose, and especially when on ketogenic diet to be careful with mirroring ketone levels. Ketone level with diabetes should not be above 0.3. References: Diabetes Co. UK/keto. How the ketogenic diet works for type 2 diabetes. Answer by Pankaj Sharma. Diabetes: How to Manage Yourself by Himadri Shankar Barthakor, MBBS, MD, Internal Medicine, Executive Director, Asundra Super Specialty Hospital. Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes from the food you eat. Insulin, a hormone made by the pancreas, helps glucose from food get into your cells to be used for energy. There are about 200 million people with diabetes worldwide, and by 2025, this number is projected to increase to at least 333 million, including approximately 80 million in India. One form of diabetes occurs: the insulin-making cells of the pancreas are permanently disabled. This is type 1 diabetes, once called juvenile onset, or insulin-dependent diabetes. Roughly 5 to 10% of diagnosed diabetes cases are type 1 diabetes. The other form of diabetes tends to creep up on people, taking years to develop into full-blown diabetes. The insulin-making cells get exhausted and begin to fail. This is type 2 diabetes. This is the more common type of diabetes, which will be explained here. Symptoms of diabetes generally include increased thirst, increased appetite, fatigue, increased urination, especially at night, unexplained weight loss, blurred vision, sores that do not heal. In some cases, there may not be significant symptoms, especially in pre-diabetic stage. Who are at risk? Type 2 diabetes. There are a number of risk factors that increase a person's risk for developing pre-diabetes and, ultimately, type 2 diabetes. Some of these characteristics are beyond a person's control, such as modifiable risk factors for type 2 diabetes. There are also a number of modifiable risk factors. By making healthy changes in these areas, one can work on these points and improve their overall quality of life. Complications that can occur in diabetes. For people who have ongoing diabetes, there are a few important points to look out for. What health problems can people with diabetes develop? Over time, high blood glucose leads to problems such as heart disease. Steps to lower these risks and help managing diabetes. Although it is difficult to be eliminated as a condition, you certainly can take steps to take the advised treatment and alongside manage your diabetes and stay healthy. Following a few changes can dramatically improve your management of diabetes and lower the chances of the risks involved. The same changes can also lower the chances of developing heart disease and some cancers. 1. Control your blood glucose. Keep your blood sugars within a healthy range. This is the best way to prevent long-term problems from diabetes. Keep a record of your blood sugar levels. Share it with your doctor or other healthcare team members. Work out a care plan for good blood sugar control. 2. Stay in shape. Engage in regular physical activity and try to control your weight. 3. Avoid inactivity and habits like long hours on television. 4. Diet. Some dietary changes can have a big impact on the risk of type 2 diabetes. A. Choose whole grains and whole grain products over highly processed carbohydrates. B. Skip the sugary drinks, and choose water, coffee, or tea instead. C. Choose good fats instead of bad fats. D. Avoid trans fats. These bad fats are found in many margarines, packaged baked goods, fried foods in most fast food restaurants, and any product that lists partially hydrogenated vegetable oil on the label. Avoid red meat. Good fats are the polyunsaturated fats found in liquid vegetable oils, nuts, and seeds can help a lot. Eating polyunsaturated fats from fish, also known as long-chain omega-3 or marine omega-3 fats, are written help overall in the reducing cardiac risk for all, including diabetics. 5. If you smoke, try to quit. Smokers are roughly 50% more likely to develop diabetes than non-smokers, and heavy smokers have an even higher risk. 6. Prevent or delay diabetes problems like diabetic feet, eye issues. 7. Control your blood pressure. High blood pressure makes you more prone to heart and kidney disease, and stroke. Exercise, lose weight, and eat a low-salt diet. Doing these will help you lower your risk factors. 8. Be sure to keep your cholesterol low. High blood cholesterol makes you more prone to heart disease and stroke. If you have diabetes, keep your LDL, bad cholesterol, low. It should be less than 100 mg/d. I'll ask your doctor about the best methods for meeting this goal. 9. Check your feet every day. Diabetes can damage nerves and cause pain or loss of feeling. Often this happens in the legs and feet, called peripheral neuropathy. This can increase the risk of foot infections. Your doctor should examine your feet for early signs. Wear well-fitting shoes and always wear socks. Check your feet every day. See your doctor for signs of infection, a cut, or sore on your foot that doesn't heal. 10. Know the signs of heart disease. If you have diabetes, you may have common signs of heart disease. These include chest pain or shortness of breath. But, you may also have signs that are not common: pain in the jaw, shoulder, or abdomen, pain down the arm, nausea and dizziness. 11. Feel good by avoiding stress. 12. See your eye doctor yearly. Diabetes can damage the small blood vessels in the eye, retinopathy. Often, the first symptom you will notice is poor vision. And, it even leads to blindness. An eye doctor, ophthalmologist, can find problems early. This doctor can examine the back of the eye. This will detect signs of damage before your sight is impaired. 13. Watch out for low sugar, hypoglycemia. People may have blood sugars that stay low in an ongoing treatment. This may mean that your medicine needs to be adjusted and you need to discuss with your doctor to adjust and steps to be taken in low sugar. Testing can help you catch low blood sugar before symptoms kick in. Symptoms include dizziness, confusion, sweating, hunger, loss of consciousness. Refer to our blood sugar and BP tracker in the guide, which will help you immensely, making quality healthcare affordable. Thank you. Answer by Kishore Ashokan. I am diabetic personally, and my blood glucose level was very much out of control few years. I had been regularly taking medications, but nothing was working well. Everything is all about excuses. We need to change our lifestyle to fight diabetes along with proper medication. These are few things that I did, and I got my HbA1c level from 11.8 to 6.9. Check this out on my entire process of how I reduce my HbA1c level from 11.8 to 6.9. I also suggest trying weight training if you are not having any other health issues. That works out well. Diet is an important part. You are what you eat, so eat natural food. Avoid all direct sugar and processed food. Food to eat if you have diabetes. Fighting diabetes naturally. Hope these information are helpful. Please feel free to ask any questions that I can answer with my experience of fighting diabetes for the past 15 years now. I am not a doctor, so please check with your doctor before you make any changes in your lifestyle.